everyone, in this video, we are going to explain about neck injury that common occur among athletes and sedentary people.
So you guys will know about the type of neck injury, treatment, and the type of exercise that can be done.
So we hope at the end of the video, you will understand about these injuries and take precaution to avoid from getting it.
Okay guys, let's roll up.
Types of neck injuries is divided by two, which is consists of soft tissues injuries and spinal cord or nerve injuries. Soft tissues injuries are strains and sprain. Strain is conditions where there is injury to the muscle and tendon, while sprain is stretch or tear ligament in the neck. The anatomy of neck strain. The symptoms of neck strain are pain, tingling, numbness and weakness that radiates down into the shoulder, arm or hand. Next is headache or dizziness, visual problems or sensitivity to bright lights, and lastly is neck instability. The anatomy of neck sprain. The symptoms of neck sprain are pain especially at the back of the neck that worsen the movement, muscle spasm and pain in the upper shoulder, headache in the back of the head, sore throat, neck stiffness or decreased range of motion, tingling or weakness in the arm. Neck strain or sprain occurs when one or more muscle, ligaments or tendon in the neck are injured. The cervical spine has a wide range of motion in all directions. This motion is supported by a complex structure of muscle, ligaments, and tendons. The large neck muscle, such as the sternocleidomastoid and the trapezius, enable the gross motor movement in the neck. The large triangle-shaped trapezius connects the back of the neck and the shoulder. A neck strain affects cervical muscle and tendons bands of fibrous tissue that connect the muscle to bones. Sprain affect the ligaments bands of fibrous tissue that connect to the vertebral bones to each other and provide stability to joints. Sprain and sprain occur when these soft tissue are stretched beyond their normal limits or torn, causing pain, tenderness, and difficulty moving their neck. Neck pain may radiate into the shoulder and over the shoulder blade and upper back when the trapezius muscle is strained. Neck strain and sprain can occur either due to a sudden injury, such as a car accident that forces the head suddenly forward and then backward in a whiplash motion. These injuries can also develop over time due to poor posture. Muscle strain in the neck can also be accompanied by inflammation around the injured tissue and neck muscle spasm as the body tries to stabilize the injury. This muscle spasm can be quite painful. Many cases of neck strain or sprain will resolve after a few days, but flare-ups or aching pain may continue for weeks or months after the initial injury. The treatment that can be applied are anti-inflammatory medication, apply cold and hot pack, massage at tendon area, aerobic and isometric exercise, wear collar, go and see to the doctor. The second type of neck injury is spinal cord or nerve injury. Spinal cord or nerve injury consists of whiplash-associated disorder. WAD is condition that result to the hyperextension. It is neck that are triggered by an accident with an acceleration-deceleration mechanism. Next is whiplash herniated disc. which is WHD. WHD occurs when the gel-like center of your disc rupture out through tear in the tough disc wall, which called annulus. Next is burners and stingers. Burners and stingers is damage of the brachial plexus of the nerve root. And lastly is fracture. Fracture is catastrophic fracture of any of the 7 cervical vertebrae in the neck. We go one by one first. Firstly is whiplash injury. It is a non-medical term describing a range of injuries to the neck caused by or related to a sudden distortion of the neck associated with extension. Whiplash can be sustained in many other ways, for example, head banging, bungee jumping, and falls. The definition of WAD is whiplash is an acceleration-deceleration mechanism of energy transfer to the neck. The impact may result in bony or soft tissue injuries, which in turn may lead to variety of clinical manifestations. The causes of WAD is the head and neck to be forced into hyperextended or hyperflex position. Other than that, it is because of acceleration-deceleration mechanism of energy transfer to the neck. The symptoms of whiplash-associated disorder are edema, hemorrhage, and inflammation. This is the example video of whiplash-associated disorder in American football. This is the example of WAD, which is car accident. Phase 1 is seat impact torso, head position increases vertically, and compression of spine and neck. Phase 2 is neck hyperextend, head strike seat, and injuries tissue of the front of the neck. Phase 3 is passengers rebounds forward from seat and head accelerate forwards. The last phase is phase 4, seatbelt restrain torso, head continues forward forcing hyperflexion, injuries tissues of the back of the neck, and most damaging phases. The treatment that can be applied are wear collar, anti-inflammatory medication. Next is whiplash herniated disc. Whiplash herniated disc, or known as WHD, occurs when the gel-like center of your disc rupture out through tear in the tough disc wall called annulus. The causes of WHD is because too much force exerted on neck and poor body posture. The symptoms of whiplash-associated disorder are edema, hemorrhage, and inflammation. Our spine is composed of individual bones called vertebrae. Our vertebrae form a protective tunnel called the spinal canal which surrounds the spinal cord as it travels down the length of our spine. On each side of the spinal cord, spinal nerve exit the spinal canal through small bony channel called neural foramina. Cervical spinal nerve travel through our neck, shoulder, and arms. Between our skull and our rib cage are 7 vertebrae that make up our cervical spine. Flexible pads known as intervertebral discs provide a cushion between our vertebrae for the range of movement your head and neck make every day. The cervical spine supports the weight of our head, allow our head to rotate and tilt, and helps we bend our neck. Cervical disc pressure increases when our neck bends forward, backward, and sideways. Intervertebral disc consists of a tough outer ring of tissue called the annulus fibrosus and a soft jelly-like center called the nucleus pulposus. During a traumatic injury, our spine may be forced forward or hyperflex, causing your vertebrae to compress the front of one or more of our cervical discs beyond normal limits. Hyperflexion of the neck is a common cause of cervical injury that occurs in motor vehicle accident and some sports. As a result, our jelly-like nucleus pulposus is pushed backward into our annulus fibrosus, thinning our annulus and closing small tears. After a cervical disc injury, our annulus fibrosus begins to weaken and tear, and our nucleus pulposus become dry and stiff. Over time, the changes make our disc susceptible to further injury. As our intervertebral disc deteriorates, a weak annulus fibrosus can allow our nucleus pulposus to bulge, changing the disc's normal shape and flexibility. Depending on its size and location, the bulge may push on or impinge one of our spinal nerve or our spinal cord, causing pain and inflammation. Central disc bulge project backwards into our spinal canal. Lateral disc bulge push into our neural foramen. Severe cervical disc injuries can tear open our annulus fibrosus. Pressure from our vertebrae may force the nucleus pulposus out of the torn annulus, causing a disc herniation. A herniated disc can impinge our spinal nerve or spinal cord that interrupt normal nerve signal and cause symptoms such as pain, numbness, or weakness in one or both of our arms. Treatment for cervical disc injuries are: firstly is rest, anti-inflammatory medication, muscle relaxants, ice or heat, physical therapy, steroid injections, and surgery. Next is burners and stingers. Burners and stingers, also known as brachial plexus injury. It is damage of the brachial plexus of the nerve root. The causes of burners and stingers is the result of traction or compressive forces on the brachial plexus. The brachial plexus between the neck and shoulder gets stretched. For example, burners and stinger is in rugby during tackle or block another player. The anatomy of burners and stingers. The symptoms of burners and stingers are numbness and weak at shoulder, tingling start above shoulder and go down to arm. The treatment that can be applied are: wear collar, get enough rest. Lastly is fracture. The definition of fracture is catastrophic fracture of any of the 7 cervical vertebrae in the neck. The causes is cervical fracture usually result from high energy trauma such as automobile crashes or falls. For example is a football player spares an opponent with his head. Other than that is a gymnast misses the high bar during a release move and falls. The anatomy of fracture. The symptoms of fracture are pain, which may or may not be severe, swelling and bruising, tenderness, decreased feeling in the arms, legs or body, and muscle weakness or paralysis of the arms or leg. This is the example video of neck fracture in gymnast accident. The treatment that can be applied are wear collar, wear rigid braces, use traction, which is using hollow brace, do a surgery.
Functional test of injured site. Performed by asking the patient to actively contract the muscles of the neck through a ROM. Performed by passively moving the patient's neck through a ROM. Performed by asking the patient to attempt to move a joint through a motion, but resistance is given, not permitting any motion occur. Strength test. The neck flexor endurance test.
To conduct the test, have your patient in supine hook-lying position. With the chin in maximally retracted position, ask the patient to lift the head and neck until the head is approximately 2.5 centimeters or 1 inch above the table while keeping the chin tucked in. Count the time the patient can hold this position and place one hand on the table below the patient's occipital bone. Cue the patient to tuck the chin or hold the head up when either the skin folds begin to separate or the patient's occiput touches your hand. Stop the test if the chin skin folds begin to separate due to loss of chin tuck or the occiput touches your hand for more than 1 second. Dominic.
Special tests. Cervical distraction test.
In the supine position, the patient has complaints of radiculopathy or numbness and tingling down one of their upper extremities for this instance. What we'll then do is we're going to utilize a chin cradle grip by go ahead and placing one hand underneath the occiput of our patient's head and then one hand on their chin, being sure that they have no issues with their TMJ. At this point, symptoms again are checked and a light distraction force is applied. If the patient's symptoms decrease, that is a positive test indicating cervical radiculopathy. You release and reassess once again.
Sperling's maneuver.
According to the study results, the Sperling's test is most provocative with the highest FAST score and most distally elicited pain with your patient's neck in extension, lateral bending to the affected side and axial compression. It is important to elicit distal pain distribution to be able to distinguish between patients with actual radiculopathy and cervical spondylosis. Other test versions were not able to distinguish between those groups as pain was mostly experienced proximally in the neck.
Exercises. Chin tuck. Sitting with neutral posture. Push your head backward using fingers. Hold the stretch for 1 to 2 seconds and relax. Neck rotation resistance band. Put the resistance band on the head. Rotate your neck away from the resistance band. Return your head to the start position and repeat. Recumbent bike. Sit with straight body posture. Stabilize your neck during the exercise and face forward. Cat and cow. Place the wrist underneath your shoulders and your hip right above your knees. Inhale and dive through your hands out your spine and look up. Exhale, round your back, drop your head and draw your belly in. Repeat the step. Seated spinal twist pose. Bend your knees and draw the left foot to the right buttocks so the left leg rests on the ground. Bring the right leg over the left so the foot is as close to the left hip. Bring your right hand behind you and rest it on the floor. Inhale and lengthen through the spine. Exhale and turn the body to the right, bringing the left arm outside the right knee. Hold for 20 seconds. To release, gently turn your head to the front and then release the hands and return to sitting position. Repeat on the other side. Brisk walk. Lesson plan. For the first lesson plan, the objective is to improve cardiovascular endurance. The main activity for this lesson plan is stationary bicycle. We do for 30 minutes and the target heart rate is 100 to 120 beats per minute. For the second lesson plan, the objective is to improve flexibility. The main activity is cat and cow and also seated spinal twist. The activity dosage is 20 minutes. For the third lesson plan, the objective is to improve strength. The main activity is chin tuck and neck rotation exercise band. The dosage is 20 minutes. Recommendation: correct your body posture when sitting and laying. When you work at computer, adjust the monitor so the top of the screen is at eye level. Use proper lifting technique. Do some stretching before do any activity. Avoid from getting high impact on your neck during game or doing activities. Conclusion: neck is a major body part for every person to do any kind of activity in daily life. We need to take care of it for use in a prolonged time. If we get neck injuries, we cannot do our activities smoothly. This is the references.